Started. We are delighted to welcome Chris Barrett to the 15th annual uh, Family Caregiver Conference. And Chris has been with Idaho Medicaid and IDHW for many, many years. I think starting in 2009. Is that right, Chris?
I think so, yeah. It's been a long time.
Good for you. We were celebrating a few of the wonderful things that Medicaid has done over the years earlier today. So we really
Oh,
appreciate your ongoing support. Chris is joining us as a bureau chief for the Bureau of Long-Term Care within the Division of Medicaid. And I'll turn the time over to you, Chris,
thank
to
you.
share updates on the A&D waiver.
Thank you. Yeah, I'm really happy to be here. I love the work that the Alliance does. So thank you for letting me come. And I'm pretty informal, so I want to go through, but I want to be sure too that I'm stopping, that I answer your questions. Don't be afraid to interrupt me if things aren't making sense. I just want to be, I'm here to answer your questions and to provide really good information for you. So just please feel free to just do whatever. Now, can you see my screen okay?
Yep,
Oh,
perfect.
perfect. Okay. I wish that would go away. Whoops.
Oops.
Okay. Well, for those of you that don't know, the A&D waiver, which stands for the Aged and Disabled Waiver, it really is designed to help individuals to stay in the community. That's what it's about, rather than long-term care. In all my years, I've never met anybody that was dying to go to a nursing home if they didn't have to. So our passion day in, day out at the Bureau of Long-Term Care is trying to help folks that want to just stay in the community and to help their caregivers to be able to do that effectively. So today we're going to talk about the eligibility requirements, the services that are available through the A&D waiver, and how those supports can help you as caregivers and to provide some relief for you. And then we'll also talk about how the waiver can promote independence and just offer some solutions. Really, the A&D waiver really is your partner in home and community-based care. And what we mean by that is literally the folks that have built our communities. We are here to help them to stay in the communities. We recognize that. We do that day in, day out, knowing that the people that really in our neighborhoods that helped to build them and help raise our children and all the good things in the communities, we want to help them to stay as long as they'd like to. I think one of the biggest things that A&D waiver does is it really does promote independence. Um, the waiver allows participants to receive services in their own homes and community settings instead of institutional care. And that really does help folks to maintain their dignity and their autonomy. I saw a question, and you might have to help me some, Sarah, about is certified family home going away? I'm not an expert on certified family homes, but I can tell you no, they're not. That program is not going away. I know there's been a lot of scares this year related to home and community-based services, but that program isn't going away. There's never been discussion about that. So hopefully that helps. The other thing about the A&D waiver is it's more cost effective. Home and community-based services are often, almost always, less expensive than institutional care. One of the things that we do in A&D waiver is we ensure that our services are less than institutional care. The waiver really does help to manage Medicaid costs, but also provide the right kind of care. The other great thing about the Aged and Disabled waiver is it really is person-centered or participant-centric, as our federal partners like to call it. The A&D waiver really does tailor services to the individual's needs, such as personal care, homemaker services, respite care, case management, rather than a one-size-fits-all sort of solution. And we really do focus a lot on participant-centered care. That's really important to us. It also can improve quality of life for folks. Remaining in familiar surroundings with family and community support. It often leads to better mental health, physical health, and just overall well-being. As I mentioned, I've never met anybody that was dying to be in an institution or frankly to be on our services at this point in their life. But we provide a necessary service. As far as what the A&D waiver can do for you as caregivers, some of the things that we might be able to offer are respite cares. And that's trained professionals that can give you some relief as a caregiver. We understand how hard that is, what an important job it is that you have. Also, to provide in-home support. It was so interesting. I had an experience a week ago. A neighbor of mine has Parkinson's, and she's really taken a decline in health. And I took dinner over, went to visit with her. Her husband is her caregiver. She'd been in a nursing facility rehabilitating and was recently released. And her husband said, there is no such thing as in-home support. He didn't even know that there was such a thing. Lucky for him, it's what I do day in, day out. So I was able to help him to understand about the A&D waiver and help him to make some connections. I think it's so important that all of us collectively help others to know that there is in-home support, that there are agencies out there, and my program can help to give you some relief and to provide support for your loved ones. There's also case management available. It's available both through the waiver and through the duals programs, which I'll talk about a little bit later. But that really is about providing some support for you. As far as case management can help you to connect the dots. This is overwhelming. It's overwhelming for everybody trying to navigate the systems, and a care coordinator can help connect you to the right services. About a year ago, the Bureau of Long-Term Care, we reinstated case management, and so we now have that service available under the A&D waiver. We didn't for a long time. The other thing is financial relief. Out-of-pocket expenses can be a lot, and Medicaid may be able to help with some of those if you qualify. Are there any questions so far? I saw a question about, is there changes about certified family home programs? Again, I'm not the expert on certified family home. Certainly happy to provide you with some contact at the end of this, Sarah, if we need to, but I don't run that program. But as far as I know, there is not. I wanted to explain the difference between Medicare and Medicaid because people get really confused. Medicare and Medicaid are two separate programs, and they're two really important programs. Medicare is the primary insurance coverage, and Medicaid is secondary. They really do run parallel, and there's differences in what's covered and in the cost sharing. Under Medicare, it's a federal program that provides health coverage if you're 65 or older and have a severe disability regardless of income. But Medicaid is a state and federally funded program that provides health coverage if you have low income, or you may have a share of cost and be able to qualify under the waiver as well. I saw a question about on our program, can a family member be a caregiver? You can, unless you're a parent or spouse, you can be a caregiver. That can work out in a couple of ways. You could work for an agency and be the caregiver. However, if your loved one lives in your home, for instance, if you're the parent of an adult child and they live with you, then yes, you would need to be in that certified family home model. But there are other ways that a family member, but if you're the parent of a child or you are the spouse, you may not be a paid caregiver under our rules. Medicaid, which is what I do, is a jointly funded federal and state government program that helps states to provide adequate medical care to eligible folks. Each state operates its own Medicaid program under what we call a state plan. And we always say at Medicaid, if you've seen one Medicaid program, you've seen one Medicaid program. Every state runs their programs differently. We all have similarities, but everyone runs it a little bit different. State plan includes both mandatory and optional services, and the Centers for Medicare and Medicaid Services, which we refer to as CMS, allows states to provide services outside of the state plan, and those are what we call home and community-based services. You might also hear them referred to as long-term services and supports, and it's both, and we'll talk about what that means. So home and community-based services, which we refer to as HCBS, that refers to assistance with, it's really activities of daily living that generally will help older people with adults or folks with disabilities to remain in their homes. HCBS really does provide opportunities for Medicare beneficiaries to receive the services in their own home or in the community rather than an institution. So if you're wondering what activities of daily living are, let's talk about those for a minute because they really are just basic self-care tasks that an individual has to perform to live independently and to remain safely in their homes or in the community. Under the A&D Waiver, activities of daily living are used to assess functional limitations, and that's what helps us to determine eligibility for our program. Keep in mind that for the A&D Waiver, we do not look at your financial eligibility. We look at your the activities of daily living. So we call that a level of care assessment. We'll talk more about that. So activities of daily living under our program include bathing, and these would be, some of these are what we consider some are homemaker and some are attendant care. So bathing, dressing, eating meals, emergency response, medication, mobility, night needs, personal hygiene, toileting, transferring, access to transportation, um, housework, laundry, meal prep, and shopping. Let's see. Your aunt wants to know, oh, I didn't see what that said, Sarah. Do you have it? I can't hear you. You must be on mute.
Thanks. So, my aunt wants to know if she has to be a certified family home to take care of her elderly mother who is now in a wheelchair.
The answer to that is yes, you should be under a certified family home in that instance. However, I can tell
Okay.
that while you're in the process of becoming a certified family home, you still can provide care for your aunt through our program as and work for an agency because it does take some time to become a certified family home. So once you start that process, you could work for an agency while you're working through that.
And Chris, for that, would they just like use the yellow pages to find an agency in their community or
We
is there a
have we
list?
have a list of agencies on our website, and we have a provider listing out there that has agencies. And at the time that we complete an assessment, our nurses also provide you with a list of agencies that are accepting folks.
So would
Okay.
that be the first step then for this individual is contact to get an assessment done?
Yeah, and we'll talk about how to
Okay,
do that.
perfect, perfect.
Yeah. No, perfect. So let's talk about what state plan personal care services means. And we refer to that as PCS. And that's they're medically oriented tasks. So it's kind of a compilation, a really condensed version of activities of daily living and very limited. So it's bathing, dressing, personal hygiene, toileting, those types of things. But it's reimbursed at a rate of only 16 hours, up to 16 hours a week. It cannot be more than 16 hours a week. This falls under what we call state plan. That is determined if you qualify for this, it's determined through that assessment we've discussed. There is no share of cost for PCS services. So for the state plan, there is no cost for that. You do have to be financially eligible, which we'll talk about here in a bit, for Medicaid. Now, the Aged and Disabled Waiver Program is an alternative, as I've mentioned, to a nursing facility admission for folks that are aged, blind, or disabled by providing what we call nursing facility level of care services. So our assessment, when we conduct it, really does determine if you would qualify for a nursing facility. But again, the goal is to keep folks in the community. So you have to meet that nursing facility level of care and you have to be cost effective. Services are more than 16 hours a week, and it includes attendant care and homemaker services, and there could be a share of cost that's associated with the A&D waiver. No share of cost for PCS, but there may be a share of cost for the aged and disabled waiver, and that is just dependent on each person. So under the attendant care portion of the A&D waiver, the services that fall under that are the bathing, dressing, eating meals, emergency response, medication, mobility, night needs, personal hygiene, toileting, and transferring. And that that's what falls under attendant care. And yeah, I'm happy to provide these slides after. I think that Sarah's team already has the slides, so I'm sure that they'll share them. And you can
Yep.
always reach out to me as well. All right, were there any other questions before I go to the next slide? I don't want to miss anything. Oh, you're welcome.
There was the question, Chris, I don't know if it was if the child is an adult and not in a legal guardianship, can the parent work for an agency to provide care without being a certified family home?
Well, if the child lives with you, then the requirement is that you should apply to be a certified family home. Now, if your child lives in their own home and you're going in to take care of them, then no, you would not need to be a certified family home. And again, you can work for an agency while you're working through that process. All right. I think I saw another question. Sorry, and I went past it.
I
They
think
pop up fast, and I
they do, don't they?
no, sorry.
I think the other was more just a comment. I was a certified family home from my first application to inspection in 2 months. There was a step-by-step guide.
Oh, good.
And she
Okay.
says, yeah, it worked well. So,
Oh, awesome.
yeah.
All right. Under the aged and disabled waiver, the second portion is the homemaker as far as activities of daily living, and that includes access to transportation, housework, laundry, meal prep, and shopping. And I really want to make it clear on these. These are for the participant. So it could be that maybe the participant lives in the home, and there are four other family members. All of these activities of daily living are exclusive to the participant only. So that means like for housework, laundry, meal prep, those services are only provided for the participant, not for the family. We are not allowed to do that. This is strictly for the participant. So we would only be looking at the common areas where the participant resides that we can provide these services. Hopefully that makes sense. Also, what's really great under the A&D waiver, I'll have to watch my time here, is that there's supplemental services. And those are additional services that are only available under the A&D waiver. These are some of my favorites because it might be chore services, case management, as I mentioned early on, skilled nursing, environmental accessibility adaptations, which is a now super fancy word for a home modification. We often will do home modifications. You may need a ramp to get in the house or help with a stair lift, or maybe we need to help with a shower insert. Those types of things are available under the A&D waiver. A PERS unit, which is the necklace or the bracelet that folks wear that will alert you if they fall. That falls under supplemental services. Home delivered meals, which are so important. Food insecurity it really is a big problem. We provide home delivered meals under the A&D waiver. Adult day health, respite, which would be, as I mentioned earlier, respite for you as caregivers, companion services, and then specialized medical equipment and supplies. All of these things can fall under the A&D waiver. These are not available under PCS only. The other supplemental services is supported employment, residential habilitation, non-medical transportation, and we also have our Idaho Home Choice service, and then milieu management. That's for if you're living in a residential assisted living. Companion services, I see that there's a question about that. The companion service is designed if our assessment determines that someone um, just can't be left alone. It's meant to be with the participant in their home. So it's not providing bathing and dressing. It's not caregiving services. Companion services is meant to be there if somebody just can't be alone. And as far as getting help with something like a ramp, once you qualify for the A&D waiver, you would just talk to your nurse reviewer, and then they determine if you meet the criteria for something like a ramp or a tub or whatever it might be. We have a really easy, I won't say easy. We have a really good program. Nothing in government's easy, so I'll never say that again. I live that every day, but we try to make it as painless as possible. So we'll help you through the process. So here in summary, between state plan PCS and the aged and disabled waiver, remember that personal care services are at 16 hours a week. It's a very limited combination of those attendant care and homemaker services. And the first for attendant care, once you're on the waiver, I want to mention that the first 277 units or the first 16 hours of attendant care once you're on the waiver, we authorize as personal care services, so there is no share of cost associated to that. And then after that, it's authorized as attendant care. But then the A&D waiver provides attendant care, homemaker services, and those supplemental services that I mentioned as well. All right, I see that there's a few questions. Let me see if I can open the chat and I will see if I can answer there or answer those. Let me get to the bottom here. Um, can I unmute? Oh, yeah. Even though I'm in the Family Direct program, oh, let's see. How do I decide if my child as an adult should use the A&D waiver or the Adult Developmental Disabilities waiver? That is a hard question to answer because it really does just depend on what the needs are. The DD program, which is our sister program, does a great job. And their program is very different than ours. Our program really is designed to have either our folks can live in a residential assisted living facility, in a certified family home, or in their own living situation, and then a caregiver would come in and help with services. The DD waiver is very different, and I'm not an expert on it, so I can't speak to it. But I think you just have to look at both waivers, and we could chat with you as well. Um, Even though I'm in the Family Direct program, and I don't know what that is, um, you're asking about a ramp. I'm assuming maybe you're on the DD waiver if you're talking about the Family Direct program, and then you would have to talk to them about a ramp. And if I'm wrong about that, then put it in the chat because I'm not sure. And as far as unmuting, I know you can hold your space bar down, I think. And if you hold your space bar down for a minute, you should be able to unmute.
I just didn't want to interrupt.
Oh, you can interrupt me anytime you want. It's okay.
So I'm so sorry. I'm so much better at talking
It's
opposed to
okay.
chatting.
Yeah.
So for the ramp, like I have two disabled adult children, and
Uh-huh.
we do the certified family homes.
Uh-huh.
And I think so they have muscular dystrophy, and it's getting harder and harder for them to walk up the stairs into the house.
Mm-hmm.
And so that ramp thing, would it be one of those things that I could talk to, like, do you think my service coordinator would have more information?
Oh,
Because,
now I'm not sure on the DD waiver about home modifications, so I'm not an expert, but
okay,
yes, you should talk to your service coordinator, I believe, or the case manager, whoever's assigned, and they could work that out. I don't know what they do on the DD waiver for home modifications. I only know on the A&D waiver. And if you have a service
okay,
coordinator, you're on the DD waiver, I think.
yeah, because I think that's what it's so confusing. The whole thing is just so
Mm.
confusing, right?
I know, I'm sorry.
Excuse me. Okay, so I because for years we've been told that unless they're like from basically from the age of 18 to like 65,
Mhm.
there's just this lost void um for help. And so that's why I was curious. Is there still this lost void for help because of the age gap? Because
No,
they're only 34 and 36.
but they are disabled. So our program is for the aged and disabled. And so
Okay.
there's a good chance they could qualify, but it would just depend. I think we'd need to look at what the better choice is for you, for your boys. And I'm assuming they're both sons, you said, but for your
Mm-hmm.
children, whether that would be the DD waiver or the aged and disabled waiver. And you're
Okay.
welcome to reach out to me and I can try and help to get you to the right folks to make that
Okay. I
determination.
really appreciate it. Thank you
Yeah.
so much.
Oh, you're very welcome. All right. Any other questions? Okay. I think if we're good, we'll move on. Okay. So, if you're wondering, this is a perfect segue, how to apply for the Aged and Disabled waiver. The best way to do that is to call our welfare office. Everything has to start with the Self-Reliance Department. I have the number up here, which is 877-456-1233. You can tell them that you'd like to apply for the Aged and Disabled waiver, the A&D waiver. When that happens, they send a notification to my team. And our super smart crackpot team manages that all day, every day. And they will forward the request to a nurse, and then an assessment will be scheduled and conducted at that time. But everything does have to start with self-reliance, and I'm going to explain why. So we have the two divisions, and I want to go slow and make sure this makes sense to everybody. There's financial eligibility to be on Medicaid programs, and then there's the medical eligibility to be on the A&D waiver. So financial eligibility is determined by the Self-Reliance Department. And it doesn't, just because you're financially eligible for Medicaid, doesn't guarantee approval for state plan personal care services or the aged and disabled waiver. It just means that you're financially eligible for Medicaid. It is also the Self-Reliance's job, their department, to determine if a share of cost for the A&D waiver services is appropriate. We have nothing to do with that. They tell us if there's a share of cost. The medical eligibility that you has to be determined to be on our services is determined by my bureau on through that level of care assessment that we talked about. We have a whole team of nurse reviewers that conduct assessments. We do about, gosh, 20,000 a year, over that actually. And we determine if a participant meets medical necessity for state plan services and or if they can be on the A&D waiver. But their services, they have to require services due to physical or cognitive disability, have significant impairment in functional independence. We have to make sure that they're safe and effective, and they have to be cost effective. The question is, what is a share of cost, and does a participant pay that? Yes, a participant would be required. So here's maybe an example. If Self-Reliance determines that you have $100 share of cost and you're on our services, then what would happen is the first $100, so let's say that it costs $1,000 a month. That's what we're paying in your behalf to an agency to have a caregiver come in and take care of you. You would pay the first $100 of that, and you would pay it directly to the agency. If you're in a certified family home or residential assisted living facility, then you would pay that $100 to them. And we reduce the payment to the provider by that $100. And again, that's determined by Self-Reliance. We have nothing to do with that. Okay, does that make sense that there's two requirements for eligibility, the financial and the medical? And I know that really trips people up and they get really confused. So I want to be sure that everybody's clear. Oh, here, I should have just moved on. Thanks for your question.
Oh, good.
Share of cost, it can vary month to month. It really does depend on what the assets are for the participant. And I would encourage you to be sure at the time that you apply for financial eligibility to disclose everything, because it is no fun when they find out that there was income that maybe you just forgot to report, and then they go back, they increase the share of costs, and you have to go back and make up that difference. So I would say disclose everything at the time. And I think I've covered all of this, but any questions about share of cost really should be, you really do have to talk to the Self-Reliance office. Let's see, Joanne, you're saying I'm on the DD waiver. You have friends on the A&D waiver. Woohoo! Now I will know that what they're talking about. Oh, good. I'm glad it's helpful. Thank you for that. Is the financial eligibility based on the participant's resources? It is based on the participant's resources, because the aged and disabled waiver is for adults. If it was a child, then it would be based on the parent's resources, but this is based on the adult's resources. So that medical eligibility that I talked about is based on that level of care assessment. And that's where a Medicaid nurse reviewer, we refer to them as nurse reviewers, but they are RNs and LPNs. We just recently have started using LPNs for some of our assessments, but they'll conduct a level of care assessment using what we call the Universal Assessment Instrument, or we refer to it as the UAI. The assessment really does determine the participant's level of care for services as either the PCS or A&D Waiver. It is solely focused on activities of daily living. So what you'll notice in our assessment is we don't really talk about medical diagnosis. We gather information, but this is not based on that. It is based on activities of daily living. Our assessments are conducted on an initial and annual basis. We also do what we call a significant change assessment. So it could be that during the year, maybe there's a fall and there's a decline. The agency or the provider can submit a significant change at any time and as many times as needed during the year. And if it warrants, then we may increase the amount of hours that we're providing based on the level of care. Participants can invite anybody they would like to our assessment, and then we encourage them to. Family members, service coordinators, care managers, legal representatives, anybody that they choose that they would like to be present. The better information that we get during our level of care assessment helps us to do the best assessment possible to make sure we're getting the right care for you. And I would also say, because so many of you are caregivers, it's so important to be honest in this level of care assessment. It's no fun to have our nurses ask about, are you incontinent? Nobody wants to talk about that. Can you bathe yourself? Can you dress yourself? And so often the participant will say, I can take care of that, but they're struggling. So it really is important to be honest, because what will happen is then you may not get the hours that are required to provide the relief that you need as caregivers, but more importantly, the hours the participant needs to have a caregiver dedicated to help them with those activities of daily living. So even though it's really hard, it's really important to be honest so that we can help you the best way possible. Once that level of care assessment is completed, then the nurse reviewer will come back, they finish up the assessment, and through our system, they notify Self-Reliance of whether you're approved or not for the waiver or personal care service. Then the participant's notified by a notice of decision. If approved, the participant then selects an agency to provide those services, which may be a certified family home or if they want to live in a Ralph. And then the Bureau of Long-Term Care or one of the duals providers, which we'll talk about in a minute, we create the authorizations for either A&D Waiver or personal care services based on the assessment determination. The nurse will not tell you at the time of the assessment whether or not you're eligible. They may have an idea, but we ask that they not tell you because you never know. They may get back and find they fat fingered something. Everything's based on an algorithm. The nurse uses their clinical expertise on those important questions, but the nurse has no sway in whether or not what the algorithm determines as far as level of care points. And so that's why we ask the nurse not to share that information. We want it to be formal so that you know formally whether or not you get a notice of decision. Agency choice is really important. So that service and provider choice form and a current provider list is discussed at the time of the assessment. The nurse will give you the provider choice form in case you are eligible for our services. The participant always has the right to choose their service provider and can never be coerced. It's really important that they have that opportunity. And we have to have a service and provider choice form on file. We do that electronically. Kelly says, is funding for the availability of A&D or DD waiver service threatened by the state or federal level of current proposed legislation. Not that I'm aware of. I mean, this session is not over with, but right now there is no talk of these services going away. I think that I have confidence that our legislators understand the importance of these services. Home and community-based services are way more cost effective than folks that would end up in a nursing facility or other type of facility. All right, any questions so far? Any other questions I can answer before we move on? We have about 20 minutes left. I want to talk about dual eligibles because it's really important in our program. About 60% of the people that we serve are considered dual eligible. So what a dual eligible beneficiary is, they have Medicare and Medicaid. And when you have those two, you're considered a dual eligible participant because you've got both programs. A dual eligible beneficiary, they have to be enrolled in Medicare Part A and B, and you have to be on enhanced Medicaid, and that makes you a dual eligible. You have to live in an approved county, and right now, pretty much all of the counties in Idaho are duals. They receive most of their Medicare benefits and services from a duals plan health provider. The duals programs are managed by Molina Healthcare of Idaho and United Healthcare of Idaho. And providers, you may be responsible to verify eligibility and submit claims to the appropriate entity as a provider. So they could be on what we call fee for service, which is with us, Medicaid, with Molina or with United. Now, here's the really good news. I also manage the duals programs. I stood up the duals programs when they first became out. My cohort, Ali Fernandez, and I stood those programs up and we ran it for 10 years. It went to another bureau, but just this year came back to my bureau as well. So we know a lot about duals, and I really believe in the program. It really is one plan for Medicaid and Medicare because those are very complex systems. One of the great things about the Medicare Medicaid coordinated plan, which is the MMCP, is that it takes your Medicare and your Medicaid and it combines it into one plan that's managed by United or Molina. If the participant elects to be on the MMCP, the provider then submits claims to United or Molina, not to us. And they'll have all their information. We know, and the providers know in the Medicaid system who they're with. But the MMCP health plan providers, one of the good things is that once you join the MMCP, like United would pay all existing providers for 90 days as out of network if they're not contracted with the plan, and the plan generally will try to contract if possible. So there's the Medicare Medicaid coordinated plan. That one is Medicare and Medicaid. I don't know if St. Luke's is accepting United. I've not heard that, but I'm going to write that down and I am going to find out. Thank you. Okay, let's see. Now, for Medicaid only, if you live in a county that is mandatory, then we have a program called Idaho Medicaid Plus. So in this instance, the duals providers would provide most Medicaid services, and it's Medicaid only. So what this means is you could have Aetna for your Medicare, and then you would have Idaho Medicaid Plus for Medicaid. So you could have two different insurance carriers if you're on Idaho Medicaid Plus. And again, Idaho Medicaid Plus is administered by Molina or United. Now, if you're on the MMCP, if the participants on the MMCP, they would not need to be enrolled in Idaho Medicaid Plus. This is only for folks that live in mandatory counties, are duals, and are not on the MMCP. And we know who's who and can help you to navigate that. Are there any questions so far about the two plans? In most instances, I would say that the MMCP is a great option for duals beneficiaries, and they offer great supplemental services. Um, in addition to the ones that I've talked about on the A&D waiver, and these would be for anybody that's considered a dual. And their care coordination in both of these plans is unsurpassed. Really, for you as caregivers, I love these plans because as you're trying to navigate really complex health systems, they have care coordination offered in both of the MMCP and Idaho Medicaid Plus that is better than probably what we can offer on fee for service. These are folks that are tapped into the community that can help you on things like St. Luke's or finding a specialist. Or we had a situation where somebody was renting and they had mold under the kitchen sink that kept dripping. They could not get it taken care of. They called their care coordinator, and it's when the care coordinator called the landlord, then suddenly those things were taken care of. They can help with many things. So it really is a benefit for you as a caregiver as well. If you do the duals, do they cross the state line into Washington? If you're talking about if you've got providers in Washington, so maybe you live in Coeur d'Alene and some of your providers are in Washington, then in most instances, yes, those things are taken care of. We'd have to look at it on a case by case. But remember, our main goal here is to take care of the participant, and we have many participants that receive services out of state. Your son is I think mean MMCP, and his dentist is having a problem with United finding him under the dental coverage. The dental is a carved out service. It's not part of the MMCP. So dental has to come under fee for service. That would be just on the regular Medicaid service. If you're wondering how to get a care coordinator, I didn't put this in the slides, but maybe Sarah, you could type it in there. Idaho Duals at dhw.idaho.gov. If you want to email there, one of my staff will be happy to get you to the right people. Yes, again, these slides are available. Sarah and her team have those.
Could you
Okay.
say that one more time for the?
Yep. Here, let me type it in. I think I can.
Okay. Okay.
When I get on these kind of things, I have a hard time multitasking.
You're doing a great job. Yeah.
Okay, I know we have 15 minutes.
I did get a response back on the St. Luke's and United question that came up earlier. I just texted with one of their leaders, and United Healthcare has about 550 duals within the St. Luke's health system.
Okay.
So it sounds like they are accepting, St. Luke's is accepting United.
Yeah, and if you're struggling with any of that, again, the Idaho Duals, my team can navigate and help you with that as well. Okay, so here's the summary on eligibility. Home and community-based services, we're here to help your participant to stay in the community. They may be eligible for Medicaid financially or through the medical assessment. And maybe I didn't make this clear. It could be that the participant they're not eligible for Medicaid financially. They can still get on Medicaid through the Aged and Disabled waiver. That's where that share of cost comes in, is that if you meet the requirements for the A&D waiver, then you have access to all of Medicaid as long as for medical needs you are eligible for our program. We have to conduct that assessment to determine eligibility. You may have a share of cost, and dual eligible receive their services through one of our managed care organizations. The extra benefits for duals, it really does depend on the plan, United or Molina. But again, if you want to email that Idaho Duals, I'll be sure that our staff give you some information, and we can hook you up with both plans so that you can see them. I know I was looking at one of them yesterday, and they had like a $200 over-the-counter benefit where you could buy, vitamins and Band-Aids and all kinds of stuff. They have a catalog that you can order things, and they have extra podiatry visits, and I think I saw gym memberships and $200 towards eyewear and all kinds of great things. When I started the duals about 12 years ago, the only benefit was $100 towards eyewear, and you had to pay $25 for a gym membership, and they're really nice benefits now. How much time do you have between the assessment for the A&D waiver when you have to implement it? It's a great question. Once we decide that you are eligible and you have a provider, authorizations are in place, we are required by state and federal rule that you have to the participant has to have an A&D waiver service every 30 days, or we're required to close your account. You can reapply at any time, but you have to receive an A&D waiver service every 30 days. And these are community-based services. Keep in mind too, I get the question all the time. We want to go on vacation. We'd love to take our son with us. But he has a caregiver. Well, if let's say that the brother's the caregiver, you can receive services in the community. They have to be appropriate. So if you're in a hotel, you would not be able to get homemaker services, but we would still help with bathing and those types of things. Really important to us that folks have access to the community. It's the whole point of our program. The respite care, I don't know about 24/7 care, but you can talk to your nurse reviewer, or let me put another email in here that you can email the BLTC staff and they can get you to the right person. Okay, I know I'm running out of time. I was worried I wasn't gonna, oh, look, we're at the end. I thought, usually I just talk my head off on this kind of stuff. Okay, so Kelly says you're asking questions around the same subject. It's okay, I want to be sure I'm doing this. In early 2026, the Idaho legislators considered roughly 22 million in Medicaid budget cuts proposed by Governor Brad Little. I understand the concern. I do understand the concern. As far as legislation and budget cuts, I'm not the right person to ask about those things. I can tell you that right now, there are no further budget cuts. And I will say that our, the head of Medicaid at this point, Sasha O'Connell, is amazing. And she was very concerned about certified family homes. That's why they were exempt. She also exempted the personal care services, those attendant care services. They did not receive the 4% cuts either. And she is doing her best because she really, I think, is doing a fabulous job of helping legislators and the right people to understand how important home and community-based services are and what will happen if they're not available. I'm sorry, I'm just not the right person. I mean, am I worried about it? I can honestly tell you I am not. I'm not worried that those will be cut and that you will be left on your own to take care of your loved ones. I'm not concerned in the least. All right, other questions I can answer.
As a follow-on to that question, I think the voices that the legislators have heard from individuals that do rely on Medicaid and the dual eligible programs and the A&D waiver, I think that's been really important to supporting the director, Sasha O'Connell's position in terms of why these elements of the plan should not be impacted. So I encourage all of you to contact your elected officials and tell them your story. Let them know how important this is to the constituents that vote them into office. So we really appreciate you using your voice, and I think it's really essential that you do so.
I agree. So many times until you have a loved one that needs to stay in the community, that's faced with going into institutional care or being able to stay in the community, people just don't often know. It really is you becoming educators and ambassadors in your community to be able to share. We did a marketing campaign a couple of years ago, and I loved our marketing campaign because we really did talk about help the folks that have built the community stay in the community. But I think so many people don't understand that maybe their neighbor only gets to stay their neighbor because a caregiver comes in and helps them to get a bath, maybe just 3 times a week, to help them to dress, that cleans up their home. They don't know, and people don't know what they don't know. So I'm with Sarah. The more that you can educate the better, because so many people just don't understand. As far as the financial eligibility, again, if the participant is an adult, we look at their resources, not their parents, but financial eligibility is based on what their resources are. Um, Let's see. Your son started receiving the benefits card from Melina. Will this benefit need to be reported as an income? I'm not sure what that means, Teresa. I don't know what a benefit card. If you're talking about the over-the-counter, I mean the supplemental benefits, no, that's just that's something that's allowed under the MMCP that they can offer those kind of benefits. Has nothing to do with financial eligibility, if that's what you're talking about. And you can hit the space bar or unmute. Oh, yeah, the over the counter and food. No, those don't have to be reported. That's part of the program. Any other questions I can answer?
Boy, Chris, you have really engaged your audience. I think the questions have been wonderful, and you're
You
just
too.
so open to wanting to connect people to the resources and showing them your approach is calming
Thank you.
and very assuring. I
Oh,
think during
thank
this
you.
really vulnerable time where people are having lots of questions about what the future looks like,
I know. It's
you're
scary. It's
yeah.
scary on this side too. Our staff are, they have been equally nervous, but I really can tell you, and I think if Sasha was sitting next to me, she would tell you the same. I really am not concerned about home and community or long-term home and community-based services, long-term services and supports going away. But again, I mean, I'll just say it one more time before we're done. The more that you educate stakeholders in the community, the better. You're the ones living it. And we do our best to make sure that stakeholders know what these services are and how important they are. But I think we're going to be okay. I mean, are we maybe facing, some cuts ahead? I don't know, maybe. I mean, and I can tell you this, I had a call from a CEO from a home delivered meals yesterday, and he was telling me that every state in the nation is facing these same kind of concerns. It's not just Idaho. This is nationally. People are worrying about our home and community-based services going away, but I just, they can't go away. They're so important. So anyway, if you ever have questions, you're welcome to reach out to me. I love to connect. I love what we do at the Bureau of Long-Term Care. So proud of my staff. They're just so dedicated. You don't work here for the money, that's for dang sure. And you don't work here if you don't love stress. So my staff are they're so amazing. They love their jobs. They love to do good work. And I will say this, the duals providers, I have a good relationship with them. Part of my job is to hold them accountable. If you have problems with them, call me as well. They know that I will hold them accountable. I have no problem doing that. They need to do everything they promise, but they want to get it right as well. So I feel like we're here to serve you. That's why we have jobs. And so if you need anything, you reach out. Is there anything else that I can answer?
That's just excellent, Chris. I just want to give one more plug to those of you that indicated that you felt like your communications with your legislative officials, your elected officials haven't been heard. Everyone will be up for reelection this fall. I would strongly encourage you to share that lack of connection that you've experienced with your voters in your districts. I think it's really important that that elected officials respond and respect the folks that they represent. So please, I would encourage you to use that information this fall, share it with others, but continue to try to reach out. I know they care. They're very busy, but yeah, it's part of their role as our representatives. So.
All right. Thanks for inviting me. Thanks, everybody.
Yeah, I think that the breakout room will close in a few minutes. This has just been wonderful, Chris. Thank you so much for
Oh,
taking
sure.
a piece of your Saturday.
Oh, happy
And
to.
I
I'm going to go
think,
hang out with grandkids.
oh wow, cool. Now
And I
that's
think I'm supposed to tell you to click on leave room, which is in the bottom right-hand corner. Don't leave the meeting because you'll be sad. So just leave the room.
that's right.
Thanks, everyone. Have a good day.
Thank you, Chris.